This video proves that people can still biologically reproduce after they are dead. Many Israel families are now fast adopting this process after the 7th of October, 2023, when Hamas broke into Israel and caused mayhem. Events can change history, and wars have introduced innovations. Though this practice have lasted for decades, but it is now fast gaining recognition. The first part of this video will explain who, where, and when posthumous sperm retrieval, PSR, had been implemented, and the satisfying results, the religious controversies, the parliamentary debates, and some countries that have adopted them apart from Israel. The second part of the video will explain the step-by-step procedures used in sperm preservation.
Reef, an IDF soldier, who was 20 years old when he was killed in southern Gaza on the 6th of April 2024 by Hamas. His sperm was retrieved, and is still in the sperm bank, waiting for a woman, who will be selected by his family, to use it for conception, at the time of making this video. The woman must undergo some medical examinations prior to starting the pregnancy. Many Israelite women come to the hospital, willing to help dead soldiers carry their babies for their next generation. Israel is surrounded by enemies, and anything can happen in a second. The sperm bank in Israel is becoming busy than ever. Before 7th of October, 2023, a family will formally approach a court for approval before posthumous sperm retrieval, PSR, is carried out. However, the legal hurdle was removed since Hamas entered Israel and killed many. While 251 were taken hostage back into Gaza tunnels. 75% of parents have requested that their children's sperm should be retrieved, while 25% of widows have also requested that they need their husband's sperms retrieved to enable them have more children. Kelvin is another 20-year-old soldier killed by a Hamas sniper in the Gaza Strip in 2002. The family selected a woman, Irit, to use his preserved sperm to conceive. She gave birth to a baby girl, Kelvin. She is one of the first known child from a dead Israeli soldier. In 2024, Osher was 13 years old. After 7th of October, 2023, where 1,600 Israelis, including 834 civilians, were killed by Hamas, according to Isreal Defence Ministry, this practice of PSR, to preserve dead soldiers' lineage, have increased in Israel. This is to continue the lineage of the men killed during wars. Over 170 posthumous sperm retrieval, PSR, have been performed since October 7, 2023, both on civilians and on soldiers. This is 14% of all men who have died in the war, which means that this is 15 times more of posthumous sperm retrievals performed before October 7, 2023. This statistic could have been more, but some soldiers' bodies were retrieved after 72 hours. Doctors requires the dead body to reach the lab theater within 24 hours to 36 hours after death, or, at least, 72 hours. After these periods, it will be difficult to perform PSR, because the sperm cells will begin to die off, according to Dr. Itigat. An incision is made in the dead person testicle to perform the PSR. The sperm cells are isolated, frozen, and stored until the family is allowed to use the sperm to continue his generational lineage. Same legislation is going on in Ukraine to help soldiers have children after they die. But France, Germany, and Sweden, for example, are among countries that do not want to permit this practice at the time of making this video. This could change in the future. In some countries, sperm retrieval will not be carried out if the deceased had not requested for it legally when he was alive. Israel lawmakers want to pass a bill introducing this same concept, that if the deceased actually wanted to have children before they were killed, they should sign a formal document before going to war. Families need to prove this in court. This debate to pass the bill into law has failed severally. Some religious leaders want the dead soldier written consent to be included in the court approval due to some religious reasons. Chief Rabbi Yosef, of the Gush settlement, is completely against the use of sperm from dead men to give birth to children, especially if they have not given consent and if they were unmarried. He wants the body to be buried whole and intact, according to the Jewish tradition. Rabbi Yuval Sherlow wants the process to be carried out with respect, and families should be allowed to continue the man's lineage. Some religious Israelites condemns the practice, accusing the practice as playing God. There was no such existing law in Israel before now. Hamas, Hezbollah, and other Iran proxies have sparked the use of PSR to preserve the lineage of dead soldiers who are ready to defend Israel. Lawmakers are finding a solution to make the practice legal. Many parents in Israel, like Rachel Cohen, who lost her son, Kelvin, in Gaza, urged lawmakers not to interfere with the practice, because their children's sacrifice is keeping them alive in Israel and in the parliament. Asher Shakar, a bereaved father, warns the lawmakers not to cause soldiers to start refusing going to war, for fear that their parents and families would not be able to help them reproduce their own kind after their death. Meirov Ben-Ari, a member of the Israeli parliament, said that religious considerations are holding them back from passing the bill. Ukraine have passed similar bill into law in February 2024. Ukraine lawmakers confirmed that deceased Ukrainian soldiers' sperm does not have to be destroyed and can be used by their partners posthumously. Before Russia invaded Ukraine, many fertility clinics in the country, which had previously catered mainly to foreign patients, started to offer free sperm freezing and discounted fertility treatment to soldiers and their partners. In addition, according to Professor Stefan Kumil, a gynecologist, at the Medical University of Gorbachev, Ternopil, Ukraine, fertility of soldiers who survived the war could also be affected. He said that 50% of the injuries suffered by soldiers on the war front involve the reproductive organs. In addition to physical injuries, some traumas affect infertility. There is also stress, tension, hypothermia, and disturbed eating. Similarly, in 2023, the Health Ministry in Russia announced funds for the storage of sperm of soldiers fighting against Ukraine in the war. In India, the Delhi High Court ordered Delhi's Ganga Ram Hospital to release Pretinder Singh semen, which was stored in their fertility lab. He had been diagnosed in June 2020 with non-Hodgkin's lymphoma, a form of blood cancer, and was admitted to the hospital for treatment, where he later died in early September 2020. But before he began chemotherapy, when he was alive, the hospital advised him to store his semen, as the treatment could adversely affect the quality of his sperm. Pretinder Singh was unmarried, before his semen was frozen, on 27 June 2020. He later died in early September 2020. A few months later, when the grief-stricken parents sought access to their son's frozen sperm, the hospital declined their request. They then petitioned the Delhi High Court. The verdict came in 2024, after a 4-year legal battle. The parents, who are in their 60s, told the court that they would bring up any child born using their son's semen sample. And in the event of their death, their 2 daughters have given an undertaking in court that they will take full responsibility for the child. Now, you can see that preserving sperm posthumously, or after an individual's death, is a procedure used to permit for possible future conception, often in cases where a departed individual, or their family, wishes to continue their genetic lineage.
Here's a step-by-step breakdown of how posthumous sperm retrieval, PSR, process works, with the legal and ethical considerations involved. Number 1. Legal and ethical considerations. A written consent documentation is requested by many jurisdictions, from the deceased for posthumous reproduction. If this documentation is not available, families will need to seek court endorsement. Also, family members, especially spouses or partners, are often involved in the decision-making, and their permission may also be essential. Number 2. Timing of retrieval. Sperm retrieval is time-sensitive after death. It is important and viable for preservation that within 24 hours to 36 hours after death, the sperm should be retrieved. At most, the retrieval should not go beyond 72 hours. Sperm quality degrades with time. In addition, facilities with expertise in fertility, known as andrology, which is a branch of medicine concerned with male reproductive health, are needed to ensure a viable retrieval procedure was carried out. Number 3. Sperm retrieval procedure. The surgical extraction of sperm can be collected through many methods. The first method is through testicular sperm extraction, TEES, where small portions of testicular tissue is removed to extract viable sperm. The second method is via percutaneous epididymal sperm aspiration, PACER, where sperm are drawn out directly from the epididymis using a fine needle. The third method is through electroejaculation, which is a rare case, where electrical stimulation of the prostate may be used to induce ejaculation, though this requires specialized equipment and is less commonly performed post-mortem. And the fourth method of extracting sperm is through tissue preservation, where the collected sperm, or tissue, is immediately preserved to maintain viability. Number 4. Cryopreservation of sperm. This starts with the freezing process. Sperm is typically cryopreserved in liquid nitrogen, at -196 degrees Celsius to stop cellular processes and maintain viability over time. And the storage in cryobanks process, where fertility clinics, or cryobank store, cryopreserved sperm in secured tanks, where it can be maintained and preserved indefinitely for future use. Number 5. Fertility planning and assisted reproductive technology, known as ART. Vitro fertilization, IVF, is recommended if the sperm contains limited quantity, and sometimes have reduced motility of posthumously retrieved sperm. Then, IVF with intracytoplasmic sperm injection, ICSI, is commonly suggested. In the embryo storage or implantation, once fertilized, embryos can be implanted immediately to a woman uterus or stored for future use, depending on the preferences of the surviving partner or family. Number 6. Legal and regulatory documentation. The court could request for inheritance and parentage rights to establish the child's rights and inheritance status in the family, if it involves sperm used posthumously. Also, birth certificates and parent acknowledgement by the courts may need to be involved, to establish legal parenthood of the deceased in certain jurisdictions. Number 7. Long-term counseling and support. Grief counseling is a complex emotional feeling, which only persons who lost their child would understand. So, grief counseling and support services for family members can be beneficial. Also, family planning guidance for the family members may be needed regarding timing, and future planning around ART procedures, pregnancy and child upbringing regarding the psychological effect of not having their father around, helping to address other legal or ethical concerns. With these 7 steps, a family can carry out a posthumous sperm preservation process, to allow them to have children and grandchildren after their son is gone. It is clear that all the countries at war are fast adopting this, than countries that are not at war. Israel is a family-oriented society, and like Baruch Posniansky, who died in 2008 from cancer in Israel, today, his memory lives on in his 7-year-old daughter, Shira. What is the PSR procedure in your country, or what is your view about the practice? Do let us know in the comments section. For more educational video like this, do subscribe to the Kelvin Academy YouTube channel. I will see you in the next one.